Hi, good afternoon, everyone, and welcome to this week's iteration of the 2021 webinar series hosted by the National Minority Quality Forum. I'm Mia Keeys with the Office of Congresswoman Kelly, where I serve as Robin Kelly's Chief of Staff. And as always, I'm very excited to be joining NMQF for Fridays. This is my favorite part of my Friday before 5 o'clock. So I must say it's certainly a pleasure. And today I have the pleasure of talking to the one and only, the indomitable Dr. Gary Puckrein, who's the CEO and president of National Minority Quality Forum. And we're just going to go right ahead and get into it. Today, Dr. Puckrein is bringing us quite some really pertinent information, not just to consider for today, but he's going to take us back into time and work our way up in terms of the historical continuum as we evaluate how we got to this place of public health crises and on top of other syndemic crises. So Dr. Puckrein, hello to you. How are you?
Great. Mia, how are you doing?
I'm all right. Thank you.
Good. I always enjoy talking with you because you understand history and how important it is to know from whence we came. So I always enjoy these conversations.
No doubt about it, for sure. You keep me on my toes as well.
What I want to do today is obviously we're going to get a chance to talk about social media, public health, because the National Minority Quality Forum, we have drunk the Kool-Aid in terms of the importance of social media. But I wanted to take 2 seconds to orient us, to help us understand a little bit deeper about the African-American experience, because health disparities are really rooted in some deep history. And when we say we want to eliminate health disparities, people think that we're just talking something clinical, that if we could just provide a little bit more pill over here, or make a little bit more access over there, that somehow we are going to get to the issue of health disparities. Health disparities are deeply linked into a historic era when it was okay to discriminate, when it was not only okay, by law, it was required, right? I mean, people went to jail and African Americans were beaten by violation of those rules. And also to understand the time sequence, how deep this is in the American experience. And I know lots of people don't want to hear that history because it's not pleasant. But if we're going to address health disparities, this is the kind of thing that to talk about. So I'm going to show 2 slides, and then we're going to get off to talking about social media. This slide was not created by me, but it was at one of our summits. A person at the summit presented this, and I asked him, it was actually a physician who presented it, matter of fact. And I was so impressed by it that I asked him for a copy of it. And so what you see here, this is the timeline when African Americans were enslaved. Almost 62% of the African American experience in 2013 was rooted in chattel slavery. That means you couldn't own property, that your healthcare, as it was controlled by your owner. Your children weren't your property. You had no voice politically. You were literally a chattel slave, and you can see how long and deep that is. And then coming out of that era was the era of Jim Crow, where there were virtually no political rights, and the great civil rights struggle culminated in 1965 when we saw the beginning of the first opportunity that African Americans had to define self in the broader marketplace, to think about their own personal destiny and how we connected to the broader society. And so it's in this period right here. Actually, I'm sorry, in this period right here, picking up around the 1940s, is when the modern American healthcare system took place, right? So it was in the era of Jim Crow that the modern American healthcare system took place during World War II. And here I'm talking about, the beginning of health insurance given by employers, and then later on, the rise of insurance and Medicare and Medicaid, et cetera. And so this is the era here where what we've been talking about, the language of the day is not equal, but equity and the elimination of health disparities. So the conversation around the elimination of health disparities gets started in the 1980s with Margaret Heckler's report. She was then head of HHS, and she did a report that documented the existence of health disparities, that African Americans and minorities generally, their quality of life was much poorer than whites. And you can understand why if you understand this history. And so this post period here is obviously the one we're living in, and you can see what's happening even in our time, how deeply this history has informed the conversation and the push back and forth, and the reason why we had 1-6, right? Because this culture that came out of here did not just affect African Americans; it affected all of Americans. And there are some who harken back to that age and want to sustain the privileges of that period. But what we're focused on is really a healthcare system that provides equitable care for each individual that comes into the healthcare system. And so the way, at the National Minority Quality Forum, the way we frame it is what we're looking for is reduction of patient risk, meaning we want the healthcare system to work to reduce everyone's risk, no matter color, creed, gender. And by patient risk, I mean reducing your risk for hospitalizations, reducing your risk for emergency room visits, reducing your risk for disability, and reducing your risk for dying. That is very, very different from this system over here, right? And so, it's with that understanding that background and how deeply rooted it is in the American experience helps you understand the nature of the struggle. I'm just going to show one other slide. This one really, for me, I think about this slide a lot. So this is a family, newly emancipated right after the Civil War. And this goes back to that era when I was talking about chattel slavery. So the hat on his head, that pipe, these clothes, those shoes, such as they are, were given to them by their owner, right? They didn't work for it. They didn't have the opportunity to work for it. It was bestowed upon them. And the quality of those clothes, what that's telling you is that the fruits of their labor did not belong to them. That was the nature of slavery, that you took the fruit of their labor and you transferred it and you gave them very little back in return, including healthcare, right? And so what's happening here for these newly emancipated slaves is that for the first time coming out of slavery, they have to take ownership of their own health, and in a society that was still deeply antagonistic to them. So anyway, I wanted to just level set a little bit so we understand the nature of the challenge that we're talking about, a cultural shift, even when we're talking about the elimination of health disparities, that it is so deeply rooted in the American experience. So,
Dr. Puckrein,
go.
So before I ask you a deluge of questions, I want for you to please explain to the audience why why you feel it's necessary that we always root our, at the start of the conversation when we're talking about health disparities, when we're talking about health inequities, why must we root ourselves in the history?
In part because you don't understand the nature of the change. When you say that you want to bring equitable care to everyone, you get the sense that we're just talking about a clinical experience, that we need to make some minor alterations in that legacy system in order to provide equitable care to everyone. And the point I'm making is that no, we have to paradigm shift. That legacy system, it can't survive the way it is because the inequities that we see in healthcare are based in the system. That's what the system was designed absolutely to do. And so when you say that you want to be equitable in care, you're really talking about reframing our healthcare system. Healthcare has probably been the slowest in terms of change. From 1965, it has not undergone the deep sort of social change that lots of other systems in our society have undergone. And so, at least from the National Minority Equality Forum perspective, that's the work that we're engaged in. We are engaged in a work to reimagine with others the healthcare system that we want, understanding that there are still people who live in the past who want to maintain the inequalities that were in that legacy system. They may not come out as boldly as I'm saying it to you, but that's essentially what the conversation is about. And so if you start to look at the legacy system in terms of policy, those policies were rooted in an era of inequality. And so, I think that's really the challenge.
That's absolutely the challenge, Dr. Puckrein. And I want to bring out just enough, I want to emphasize some of the words that you've used here. You've used several times reimagine. Well, you've just mentioned reimagine and reimagination, actively re-engaging and reimagining what our healthcare system ought to look like in order to deliver the most equitable outcomes for those who make up the residency of our nation, right? And there was a comment in the Q&A about citizenship. And so I do just want to be clear, what Dr. Puckrein was referring to was really just the recognition that those who were previously enslaved are now brought into the fold, at least de jure, not necessarily, in de facto, right?
Right,
So
right.
In law, but not necessarily in practice. So thank you for pointing that out, but that's precisely what we mean. So you use reimagine, Dr. Puckrein, you used narrative, right? You use the terminology narrative, and you also use the terminology reframing, right? And so when I think about all of those things, when addressing a multi-level complex public health crisis, as we see today, but as obviously you've pointed out, as we've been seeing for the last almost 400 years, right? Now we're at this point where we do have these platforms to reform and reimagine and reframe, and social media gives that to us, for better or for worse. It gives us that, right? So talk to us a little bit about, and I don't want to completely gloss over everything from 1619 to 2021, but talk to us about the platforms over time that have been useful with reframing, with reimagining, with changing the narrative.
Sure. So, one of the central changes came with the Affordable Care Act. If you understand the history, you understand why that was such a difficult piece of legislation, right? Because at the moment of the Affordable Care Act, 48% of African Americans had no health insurance. 54% of Hispanic had no health insurance. So think about having diabetes. Let's not talk about cancer and all those other diseases. Let's just talk about diabetes without health insurance, right? And the cost of your medicines and care and everything else that you need to have in order to manage your diabetes, the fact that you don't have a medical home. And so in that era, what was happening is it was rescue care. People were succumbing to the disease, the amputations, the blindness, all of those things were occurring because they couldn't afford the healthcare. Think about it, when you go into any healthcare facility these days, the first thing they say is, let me see that insurance card, because that insurance card tells me what I can give you, how long I can give it to you, who can give it to you. And if you don't have one, you can't even get through the front door, right? And so that was a moment of tremendous change. And so that began to open up the door. The other thing that is changing, and you can see the stress that it's putting on our society, is the browning of America, because we just didn't get healthcare. We also started to get a political voice, and you know that you're part of that of the Tri-Caucus, which is over 100 members now of the U.S. Congress. And what they're asking for is that reimagining, so that their community can have access to quality care, and that's what all of the bubbling is about, because we are going through a paradigm shift, and anyone who knew anything about American history would know that that's not going to be an easy travel, right? That it's going to be a lot of back and forth in order to get there. But I think what's critically important here is that we want to have a change that provides quality care for everyone. We're not looking to create privileges. We're just saying that everyone who comes into the system ought to get quality care. And that brings us into the world of social media. So Obamacare, browning, social media, right? And so social media has allowed these those in the legacy system to find each other, right? And also it created opportunity to put a lot of disinformation, unfiltered content. So foreigners who wanted to be mischievous could come in and aggravate the situation, as well as you've got people for their own political reasons or selfish reasons or whatever reason, puts all of that together. And the challenge for us all, at least those who are thinking about the reimagining, is that we have to come together and use social media to help educate everyone, to help them see that future, right? We have to give them a sense of where we're going. And I think that's really what the power of social media is that it helps us as we go through this very, very deep societal transition. It'll get manifested in healthcare, but it's shaping up in the broader context of the society as well.
That's the power of social media, and I don't contest that at all. But you've also just alluded to the perils, right? Which, so someone in the audience asked about the fact, made the point that we've been for so long accustomed to debate. Debate has been and opposing sides. That's as American as the Constitution, right? It's what our forefathers. That was the stage in which they were able to eventually come to agreements in terms of what the nation stands for. But now we have this more sophisticated, and I guess that can be contested as well, but we do have these sophisticated platforms whereby debate is naturally had on everything from the Capitol siege to the ACA, which was probably one of the most contested, if not the most contested pieces of legislation in our recent time, right? Over 100 iterations of the bill being contested, right? And so the perils of social media do show us just how vitriolic, a lot of the scientific debate, a lot of the political debate can, can can really not even create, but upend, right? My belief is that, a lot of what we saw, at least at the top of this year, certainly all of last year, all of that was there, right? And in terms of police brutality and anger, and which led to protests, peaceful or otherwise, and the attack on the Capitol, right? So my question to you is, Dr. Puckrein, to the extent that our quest, as those who are interested in equitable outcomes, our quest is to spread information and use social media as a tool to do that, to disable misinformation and disinformation, right? That's also that's our defensive tactic, right? How do you see social media playing out over time when it comes to what we're trying to achieve by 2030? And I'm saying 2030, especially because we generally mark health by, by decennial milestones and such like that. But I'm also thinking about the fact that the nation, to your point, will be over 50% majority minority, right? And I'm using minority loosely here because that's almost, it's ironic to say that. But yeah, so talk to us about that,
Well, first of all, we have to always admit democracy is incredibly messy, right? Because everyone has a voice, and it's important that everyone have a voice. And so if you think about this huge market square where we all come and voice, it's incredibly messy. And social media has just added to it because it allows what was once disparate voices to come together, and those disparate voices don't even have to be same, right? They could be, they could have a real alternative view of the world, and now they're finding collective voice, and so it makes it even more challenging. But the faith has to be that out of all of that noise, we can find a common ground, a center for the country, and we can't despair about that. But we also have to recognize that it takes a lot of work. It takes a lot of collaboration and building it. And I think probably the most important piece of it is that we have a sense of where we're going and what we're trying to get to, because a lot of those other voices, they're looking in the past. We can't go back there. There's no credible way to go back there, and because nobody's going back there, so it's just not a credible pathway. And social media is one of the tools that we have to use. And if we work collaboratively with social media, we can drown out that noise. You can't outlaw it. We're a democracy. You can't do that. But the way to get after it is those of common mind have to get together on social media and educate and reinforce and help people understand what that future looks like that we're trying to achieve. And I think that begins to settle people down when they understand exactly what we're working towards, and that there will be challenges along the way, because it's disruptive, right? Reimagining is about disruption. And it makes a lot of people uncomfortable because they were wedded to privileges that are no longer obtainable in the society. So that's the challenge.
So two things here. So disruption is a word I've been using for a really, really long time. I had the opportunity of co-writing a book with some nurses who are a part of Black Nursing Association and the American Nursing Association. Actually, a number of people, not just nurses, But the book is called, it's called Equity in Nursing, basically. But in my chapter, I talk about the spirit of disruption, right? And I talk about, to your point about having to go back and evaluate from an historical perspective, just those junctures in time that have disrupted the status quo. And always there has been violent upturn, right? If not at the very least, really very critical, well, not, I won't even always say critical, but just an upsurge of conversation amongst people who were considered thought leaders at the time. What's interesting to me now is, and obviously I wasn't alive back then, but it seemed to me that there were so many different stages and ability to voice certain opinions within the same arena, right? The arenas themselves were not always politically separated, right? So today we have our Fox News, our MSNBC, right? So you can tune in to the thoughts that you really want to hear that reinforce where one stands, and it really makes disruption hard. It makes reimagination difficult, right? And so I want to really just make sure that through NMQF, that the audience understands that you all are invested in providing those opportunities for voicing thoughts that may not necessarily sound useful, or not even just useful, welcome to every single body who's in the audience. And one of the things I think we can, in terms of a more timely example, I'm thinking about the whole social media conversation around critical race theory, right? And this idea that, first of all, critical race theory is new, which is ridiculous, right? But it literally requires us to go back in time and evaluate where we've come from, but it also requires for us to be present and hear out conversations, to your earlier point, that are difficult to hear, that put people on edge because they don't always understand. So I want to get into that a little bit.
Yeah. You know, so the challenge is that when you have something that is so deeply rooted in a society where by common practice, you discriminate and you define privilege. And you know, let's take healthcare, for example. Several years ago, we were asked to do a study of hip replacements in the state of California. It's about 2007. So we went back and looked, and in 1995, the white population in California was about 67%, and 80% of all the hip replacements in California were being done on whites. So we looked at the data in 2006, and now the white population in California is 50%, but 80% of the hip replacements in California were still being done on whites, even though you've had that dramatic shift. It is because the population may have shifted, but the practice of medicine hadn't shifted. The way in which we provide access to therapy, it's not that Blacks and Hispanics didn't need hip replacements, it's just that they were uninsured, they didn't have the capacity, so they ended up living in pain when they could have had a much better quality of life with hip replacements. That's but one example of, and so when you come in and you want to disrupt that, and you want to say, no, everybody who needs a hip replacement needs to get one, right? And we're not going to say that you have to have a certain income or a certain education or a certain skin color. That's not how the system works. The system works that everybody has to get a hip replacement who appropriately needs one. And you know, and what you quickly find out is people start talking about, well, you know, we can't afford to take care of everyone. We need to ration. We need to have value. You know, there are whole groups out there today who talk about value assessments and, you know, because we can't afford. But that's the legacy system talking. It's just a new language, but that's the same old system talking. And what we have to say is no. we have to take a moment and reimagine and think through the problem to make sure that all Americans have access to healthcare. And that's what's disruptive. That's the part that's truly disruptive. When you say, no, we're not going to ration, we're not going to have a tiered healthcare system. We're going to have a healthcare system that from the very beginning is focused on equity. And then we work through it to make sure that happens. That's new for America. That's the point that's why I was showing those slides. That's a new concept, and it's disruptive, and it plays out in social media and people standing online and 1-6 and all the other craziness that you see is because people are reacting to change. They don't understand the change, and they don't understand what that future looks like. And that's why social media is important, because it is one of the important tools that we use to communicate with each other right now. And so we have to be on those platforms to help people understand what the future looks like.
And speaking of platforms, tell us a bit about what NMQF is doing through some of your social media platforms.
It's kind of interesting because this the change for us really, at least for me, came with COVID. From the social media standpoint, I was a Luddite, right? I mean, I didn't know what the heck is social media. And we started working with some federally qualified health clinics. Started off with 12 and then 47, who in the middle of were dealing with the crisis in minority communities with COVID, with the high mortality rates and hospitalizations, and they were under stress, they weren't resourced, they weren't getting the information that they needed. And on top of that, there was a lot of disinformation and unfiltered content coming into the community. Think about it. One of the Kennedys was putting out information that you shouldn't get vaccinated, right? Targeting minority communities. You got the Russians running around doing God knows what, right? And all of those folks are targeting these communities. And the problem was that the community-based organizations and the federally qualified health clinics that were providing care in those communities didn't have the capacity to push back on social media. They didn't have this, they were barely resourced to take care of the clinical issues that was in front of them. And now they've got to deal with this deliberate assault on the community through disinformation and maybe not deliberate, but nonetheless, all of that unfiltered content where people say crazy stuff and it bleeds all over the society. And so we realized that if we were going to be helpful, one of the places we could be helpful was to amplify their voice, to figure out a way that we could provide a backbone for them so that their voices could be heard in social media. And it led to the development of what we call AI HealthNet. And so it's kind of a hybrid system. And so on one side, it's like Facebook. So we took each one of those federally qualified health centers and CBOs, and we gave them a web page. We call it Microsites. So we gave them a microsite. And so now they have a presence, but they're all on the same platform, meaning they all have virtually the same web address. And the reason why that's important is because we can collect information and help them find audiences, so that we could find audiences for them while they were doing their work. We were helping them in the background, amplifying their voice in community and pushing back on the social media. And the other thing, part of it was we built content, we call them content microsites. So we took a little bit of information. So this ain't WebMD where you kind of overload people and they read it and they don't understand what the hell they're talking about, and you're going on, and I just got a simple question I need answered. So what we try to do is build sites that answer very, very simple questions using infographics and not always language. And if it's language we're using, it's a short paragraph, like when you go to a museum and you go in the museum exhibit has a little placard that tells you what you're looking at. Well, that's the size of the information that we're imparting. but it's answering a question. So it's like for the monoclonal antibody. So what's a monoclonal antibody, and when do I get it, and who pays for it, and just answer just little simple stuff like that, or COVID vaccines or flu vaccine, whatever it is. And so we take those content microsites and the information that they contain, and we get them to community through the organizations, CBOs and FQHCs in their community, who are the trusted voices. So it's not NMQS voice that they're hearing Watts Healthcare. They're hearing the healthcare center in Jasper or a Samaritan in Georgia, because those folks are in community and they have the opportunity to push back. And on the back end, we're running a lot of analytics and trying to figure out who are the audiences, how do we shape the information to get it to them in the same way that Facebook thinks about things. And Facebook is trying to build a business and keep people on the site. We're not trying to do that. What we're trying to do is share information with people. And as we started to work on this, I really began to understand the power of social media. So we ended up with a partnership with Twitter. And what that allows us to do is to have conversations in social media, point them to the content microsites, and deliver that information through the FQHCs and CBOs that they're familiar with. Sometimes we have audiences of 1 million, 1,000,005 people that we're reaching, where prior to that, we would never reach an audience like that. But now we're giving them trusted information and we're learning. And so for me, it's been really an incredible experience. I used to listen to, think about, lack of a better term, what the right wing had, those echo chambers and Banner, and he had this website and they're talking and they're reinforcing each other, even though some of the stuff is quite frankly not credible, but they're passing it back and forth and people come to believe it. We have to build the same echo chamber. We have to build the same infrastructure to help communicate. And so what I say to my friends in healthcare, patient advocacy groups, fairly qualified health physicians, we have to come together, work in a common way to share information, because you can develop great medicines, but if people don't understand them, like we see with the vaccine, they ain't gonna take them. And so you have to take that next step to get information to the public, not to tell them what to do, but to give them information so that they can make informed decisions about their life. And so that's what we've been at. We've been pulling together a great team. We've hired a social media director, Grant. He's fabulous. We've worked with Kellyanne and her team at Volt Lab. They're fabulous. And we are deeply now committed to the whole social media experience.
So Luddite no more, Dr.
Luddite no more. I've given up my Luddite. I'm social media all in.
That's another thing I really appreciate about you. You're a lifelong learner. You've been here for well, I'm not going to put your age out there because people wouldn't believe me anyway. But you've been here for longer than I have, and I always feel like I'm sitting at the master teacher's feet. When speaking with you. I want to reiterate that formula that you brought up. You said you're basically, social media is the hub, and you're harnessing the power of social media to generate the conversations. But then you also mentioned two critical pieces that are a part of this formula. The one is working in direct communication and consistently with trusted voices, established voices within the neighborhoods that need to not just receive the information, but oftentimes don't have access to it, whether or not they want to hear it. Maybe it could be a broadband issue. It could be that, just people are not, don't know how to access the information, but they can go to people that they already know. They can go to the FQHCs, they can go to the CBOs, they can go to other individuals and organizations. And NMQF is working really quite intentionally to strengthen, develop new relationships, even when it comes down to working with organizations that traditionally organizations like yourself like yours have not worked with in the past, right? So that's a main takeaway from the formula. And then the other end, which you mentioned, is the data collection, right? And ensuring that those data are disseminated. And you didn't tell the audience this, but I'm hoping you can tell us more about it. You disseminate data at the zip code level, at the tri-zip code level. Can you tell us a bit more about that part of the formula?
So, when I got started in healthcare, one of the things I realized is that America is very, very segregated, and is segregated by zip code. So roughly 70% of African Americans in the country live in about 2,500 zip codes. 70% of Hispanics are in 2,500 zip codes. 50% of Asians are in 1,500 zip codes. So all the disparities that we're talking about have geographical features to them. They have structure to them. And so that enables you to target, to geo-target information. And so where success lies is getting your information so that it gets shared in barbershops and in beauty salons, right? Where people in their everyday life are coming across, not from some foreign source, but from voices that they hear every day that are informed about health policy, so that they can make really important decisions. And social media is one of the tools that you can use to do that. And we're looking for deep collaborations. This is not necessarily an NMQF project in the sense that we can do this alone. We're reaching out to other patient advocacy groups. Some of them may not even be minority serving right now, but we can say to them, yeah, but you've got some information that we can repurpose and get to communities that need it, so that the disinformation and unfiltered content that has been disruptive to their lives, we can push back on. And so, that's really how we've been thinking about this.
I couldn't get to my unmute button fast enough there. Yeah, Dr. Puckrein, so I wanted, in these last 15 minutes or so, I want for you to challenge us about what it means to take up the mantle, moving more deeply into the 21st century. Talk to us about what is required of us.
So the 21st century, at least in my thinking, is very, very different from any century before us. The 21st century means that humanity has to be woke, right? So what do I mean by that? So even as late as the 19th century, land was abundant in the United States. You didn't like it here, you walk off into the wilderness, and we were having some negative impact on the ecosystem, but not enough to really strain it and put it under real stress. We're now stressing out the very ecosystem that keeps us alive, and we have to get in harmony with it. We don't have a choice. I hear that climate change debate. They're talking as if they have a choice. I had a guy who, I won't mention his name, passed away, who used to work for me. This is very early, when we first got into the work that we were doing. He had diabetes, and he wouldn't take care of it. And he came to me one day. He was a veteran, and he said, they want to give me a triple bypass. And I don't think I want to do it. I looked at him and I said, oh no, that's not an option, right? You have to have a triple bypass. This is not like a nice to have. If you want to live, this is your option. that's where we are with climate change. This is not you're not debating with the economy or with the ecosystem. If you think you are, then you're going to lose. It's not a debate. But the whole point of what I'm saying is that the way to think about it, in the past, our biology drove the economy. That's what slavery was about. It was taking the biology of African Americans to drive an economic order, right? And a broad economic order. Now we have to build an economy that supports our biology. It's a very, very different formulation. When I talk about the change in healthcare, it's embedded in that reasoning that we have the opportunity by the end of the 21st century to have conquered many of the major diseases that early generations had to deal with. If we get to 2045 and we haven't conquered diabetes, what the hell, right? I mean, we could do that. We're moving into the end stage on the war on cancer. We're actually curing things. But in order to do all of that, we have to be woke. We have to have purpose. You got to know exactly what we're doing and what we're investing in and how we're going forward. And I think that's our future. That's the work at hand. But we're not grasping it yet. We're having these arguments, but we don't understand that there is a natural order. There are forces of nature, and we don't control them. And so the best we can do is to get into harmony with them. And I think that's really the challenge that sits in front of us. And for African Americans who have taken this deep journey from slavery to where we are, we have to now pick up that fight and move it to a reimagining of the way in which we're doing things so that everyone can have a high quality and long life. And I think that that's a tremendous challenge.
Not only is it a tremendous challenge, but I think we're tremendously challenged by distractions. And one could argue that social media can be distracting, right? So how do we then reconcile this call and coming to understand our deep purpose collectively and individually with and work in harmony, not just with the ecosystem, but with everything that's now availed to us in terms of protecting the ecosystem and raising the voice for equity, with this other side of sometimes people spend hours scrolling mindlessly on Instagram or, arguing relentlessly with people over asinine stuff on Facebook, or, succumbing to these ridiculous challenges on TikTok, So, what do you say to that?
I know, but, my answer to that, that's all good, right? Good leadership will accommodate for that. Not everyone has to be in the struggle, right? But if you have a sense of direction and can communicate with people, they can go on and have their lives. But what we just want to do is reorder it a little bit so that we pass on to the next generation a world of opportunities instead of having the system collapse on them. Human civilizations collapse, right? I mean, they're not infallible. They can break down. And so it's incumbent upon us to make sure that we enjoy the benefits of for the time that we have, but we also make a better world for the next generation. We don't want the next generation to have to deal with cancer and diabetes and all of these other ailments when we're in the middle of a scientific revolution and we have the capability to make those changes. I think the bigger challenge really is it's really the legacy system. It is really those who want to hold on to the past for all kinds of reasons. Lack of imagination, selfish reasons, political reasons. I mean, you could name them. One of the things I remind myself, and I challenge everyone here to go take a look, is people still believe the earth is flat. There's a flat earth society out there, and you can Google them.
You and I have had this conversation, and I remember the first time you brought that up. I thought that was ridiculous.
Yeah. I know, but they're there because that's how ideas are. They don't go away. They nest in some crazy places, and people hold on to them. And that's what we're dealing with. We're dealing with a legacy system that has run its course. It needs to be reimagined. It's not going quietly into the night. So we have to find ways to help those who need to understand that the moment of change has come and we don't have a lot of choice about it. So we need to get on with the work.
Get on with it. That's the call right there. That's it. So any final words before I ask for a summary from you, Dr. Puckrein?
Well, first of all, I always enjoy talking with you.
Oh, yeah.
Oh, absolutely.
Yeah.
I remember, for the audience don't know, I was at a talk that Mia gave, and she was taking people through the history, and I said, oh, yeah, I get it. Yes, indeed. You have to know the history if you're going to understand where you're trying to get to. So I always enjoy these conversations where we look both past and present and future and try to understand what the next step look like. So yeah, I'm always having fun when I'm talking with you.
Me too. Me too. And the more I listen to you, the better I hear, if that makes sense. Mm. You know what I mean? Particularly driving home the point that we've now moved on and must insist on moving beyond a system wherein our biology supports the economy.
Yeah,
right.
That's old.
Mm-hmm.
That's old.
That's one of those old legacy systems that you said.
That's what remember the lieutenant governor of Texas, in the middle of the COVID crisis, says to people, oh, you need to keep going to work and we can open up the society. And if you die, you've died in the interest of the economic order, right? That's the old school, that's classic old school thinking, right? That somehow our biology has to support the economy. That's not how we want to be thinking about things. The economy should be at the service of our biology. That's where it's supposed to be, not us giving our lives for an economic order.
And the second takeaway is essentially having to do with ensuring that we create systems where we can reframe and reimagine the narrative.
Yeah. It's both the fun part and the hard part, right? Because there's so many nuances and changes that occur. Gretchen Wortman on our staff does our health policy, and she's digging into the weeds of health policy, looking at ICD-10 codes, and because those codes kind of frame how care is delivered. Most people
and they're the money makers, they're the money generators of medicine.
Yeah. And most people don't even know what the damn ICD-10 code is, but here she is in the middle of it, helping to write codes and making those changes or creating performance measures and or pushing back on organizations like ICER, who wants to sit around and tell us that we can't take care of everybody. Some people we have to sacrifice. So it is all those little kind of nuances that are in the system that have to be changed.
And then the second to last bit, and our everyday host has joined us. Our second to last bit, Dr. Puckrein, that you mentioned as the third takeaway is that we've got to be able to leverage social media, but in tandem with working with our partners on the ground who are already established and trusted, and then also leveraging the data and making the data available and accessible and resonant with communities.
So think of social media as our Air Force, right? You got to have an Air Force to be able to deliver trusted information into community that people can use in their daily life. And it's all collaborative. You know, to get to the future, we have to collaborate with each other, and you know, to build that system that we all want, which is we want a system that takes care of our family and our neighbors, and it gives us an opportunity to pass something on to the next generation, so that they are not, we have not eaten a hole in their future and given them really a dangerous situation to live with.
And then finally, you mentioned we've got to carry this mantle forward in the 21st
Yeah.
century. It's our purpose. It's
It is. We
imperative.
actually don't have a choice, right? It means
Yeah.
if you're really thinking about it, you know that this is the work at hand, and it's the work of our generation. We have to do it. So there it is.
There it is. Dr. Gary Puckrein, CEO and President of National Minority Quality Forum. You are, I'll eat this later, but you are literally my favorite person to talk to on this webinar. And I look forward to seeing you again, my friend.
Well, you know, I always love talking to you, Mia. So
Indeed,
yeah.
indeed. Brandon Garrett, our host, has joined us today. And so I'm going to turn it over to Brandon to close us out. And once again, thank you to our audience for your energy, your engagement, and make certain that you tune in next week for what NMQF has to say. And I'm Mia Keeys with Congresswoman Robin Kelly's office, and Brandon Garrett, take it away.
Thanks so much, Mia, for covering everything this morning. And Dr. Puckrein, you're always great to have on. When I spoke to Mia about hosting this week with Dr. Puckrein, she's like, "Oh, that's just great. We can talk about whatever." and they do, and they always educate. And I noticed the comments and whatnot, so I know that it was a good topic. So, love to hear from you guys again. We'll see you next week. We'll be talking about breast cancer. As we're in the month of October, and it's something that we really need to discuss. We're going to be doing, in addition to the program tomorrow, next Friday, we're doing a breast cancer. There's a lot of work we're doing in that space in the upcoming year. So with that, thanks to everybody, and thanks to everybody's real favorite person, Keiko, who puts this on every Friday.
Absolutely. All right. Thanks a lot.
No doubt about it. Thank you,
Bye-bye.
Keiko. Thanks, everybody. See you soon.